Hello everybody and welcome to RadTips, a brand new channel for all things radiology. The way this is going to work is there'll be three different types of video. Level 1 will be basic anatomy, usually x-rays. Level 2 will be more complex anatomy, cross-sectional, so usually CT or MRI, with some basic pathology put in there. And then Level 3 will be more complex pathology, usually based around CT, MRI, and maybe a little bit of ultrasound. We'll have weekly videos in every category, so if you don't want to miss the next one, now is a good time to hit that subscribe button. Today is a Level 1 basic anatomy video of the X-ray anatomy of the hand. So now would be a good time to pause the video and to see how many of these labels you can already answer yourself. Okay, got it? So here are the answers. So let's go through them one by one, starting with the fingers. You've got 3 phalanges, distal, middle and proximal, and you've got 3 joints, the distal interphalangeal joint, or the DIPJ, proximal interphalangeal joint, PIPJ, and the metacarpophalangeal joint, or the MCPJ. The thumb is even easier. It's only got 2 phalanges, a distal phalanx and a proximal phalanx, with the interphalangeal joint in the middle. Note there's no distal or proximal interphalangeal joint, just the interphalangeal joint. Just like the fingers, there's also a metacarpophalangeal joint, and there's also a small little sesamoid bone. Sesamoid bones are just bones that are found within tendons, and the largest sesamoid bone is the patella in the knee. Moving on to the metacarpals, there are 4 distinct parts: the head, the neck, the shaft, and the base, and this is important when you're describing fractures. It gets a little trickier when we get to the carpals. There's 8 carpal bones, and we can divide them up into proximal row and distal row carpals. The proximal row carpals are the scaphoid, lunate, triquetral or triquetrum, and pisiform. Of note, the pisiform is another sesamoid bone. In the distal row we have the trapezium, the trapezoid, the capitate, and the hamate. The way I remember the trapezium is it ends in M and rhymes with thumb, and it is the one that's closest to the thumb. The hamate also has a little hook, which is readily seen on X-ray. There are loads of different mnemonics to help remember the carpal bones. The one we had in medical school was "some lovers try positions that they can't handle." I'm sure you've heard of many more. So that's a quick overview of the X-ray anatomy of the hand. And here's just a quick test to see if you've got it all. So I hope you found that video useful. If you did, hit that like button and consider subscribing. And if you have any ideas for future videos or anything you want me to cover, leave it in the comments below.